So what you want to do to combat this is three things. One, you want to make sure you maintain proper oral health and proper hygiene extremely well. If you reduce plaque and bacteria and you reduce the food and the things that stick to your teeth after meals, there's really not as much in your mouth to cause cavities, which is helpful. However, your teeth are still going to be getting subjected to a lower pH, a more acidic pH. Unfortunately, we've seen quite a few patients that they get on a new medication, their mouth gets dry, they don't realize it, they get lifesavers, they haven't had a cavity in 10 years, and all of a sudden they come in with, unfortunately, multiple cavities that came out of nowhere. That is the type of problem that dry mouth can create. So what you want to do is try to stimulate your own saliva flow and or substitute that saliva. So there's two products here that I definitely would say help with that, and one of the most important in my mind, is a dry mouth lozenge. These lozenges are okay to use multiple times a day. They have a sugar substitute in them called xylitol. Xylitol has been proven to actually reduce the number of bacteria that cause cavities and actually improve your resistance to cavities. So not only are you creating more saliva so your mouth feels better, creating more saliva so your mouth is not as acidic, but you're also fighting cavities at the same time. So use these as many times as you need. If your mouth feels dry, never reach for a sip of soda or coffee or tea or lozenge or anything that has sugar in it. Otherwise, you're going to make your issues appear. If you haven't had issues in a long time, they will come out of nowhere. Or if you have issues, you're going to make them 10 times worse. So this is a dry mouth spray. These are very helpful to make your mouth feel more comfortable. Some people that get very bad dry mouth can feel as though their tongue's burning or their cheeks burning. This helps with that, because what that burning sensation is the dryness. So locking that moisture in or creating moisture with this temporarily is helpful. There are different types of dry mouth spray. Most of the ones that you can get over the counter are water-based. Water-based sprays are fine. They're cheaper. They last a good amount of time. There's also rinses and gels that you can use. There are other types of dry mouth sprays that are more long-lasting, that are oil-based. That's something that you should talk to your dentist about. Like I said, a lot of times the ones that are over the counter are water-based, but your dentist should have access to ordering a dry mouth spray or rinse that is more oil-based and will last longer.